Good evening and welcome to Pilot School's presentation, Understanding Mood Symptoms in Children and Adolescents. It looks like we have a great group tonight and thank you for joining us. This is our third parent workshop in our 6-part series. For those of you who don't know me, I'm Samantha Spruance and I'm interim head of the Pilot School. Pilot serves children who have been diagnosed with language-based learning differences such as dyslexia, ADHD, auditory processing challenges, executive functioning disorder, and many other challenges that our students face. We provide a customized educational tailored program to each child's needs, and if needed, incorporate our on-site speech, occupational, and physical therapy into the school day. At Pilot, our motto is to unlock the potential, so we create a customized interventional education plan to fit the needs of each student. This is so much more than the accommodations offered by other independent schools. Our 5-to-1 ratio, student to teacher ratio, our state-of-the-art building, a 50-acre campus, and our on-site therapists and specialists enable us to intervene in the way that will benefit each student most. If you're interested in visiting us, we are conducting in-person tours on weekends, and we have a virtual open house coming up Wednesday, January 27th at noon. Send me a message in the chat room and I'm happy to send the information to you. For all parents, school closures, working remotely, physical distancing, and now even the nightly news has added stress to our days. It's a lot to navigate for all of us. That includes our children. At times we see their behavior and wonder, is this normal childhood growing pains, or is it something I should be concerned about? As parents, it's difficult to know. Dr. Kami Winkelspecht is here to advise us on how to make it easier for you and your child. Dr. Kami is a child clinical psychologist who works with children and families from preschool through high school. She is in private practice in North Wilmington at Child Psychology Solutions, and we are happy to have her as our presenter for each of our 6 workshops. I'm going to pass the screen over to Dr. Kami, and I invite you to submit questions via the chat room or the question and answer options. Dr. Kami may answer your questions as they come in, or may choose to address some of them at the conclusion of her presentation. We're also recording this presentation so you can revisit it at a later date. Thank you, Dr. Kami, for taking the time to educate us on such an important topic.
Absolutely. Thank you guys and good evening. So thank you, Samantha and Janet and the Pilot School for putting together and hosting this workshop series. The need for mental health awareness is important in any time, but I think more so in this ongoing pandemic. So it's my pleasure to be talking with all of you this evening. I would love for it to be a very interactive presentation. So if you do have questions, please feel free to put them in the chat room. We're going to do an activity pretty close to the start of the talk to kind of learn a little bit more about depression as well. So please ask questions. I know that everybody who joins tonight joins with a specific kind of thought or question or story in mind. And so please, ask questions and help us make the content as relevant as possible for all of you. When we do the myths versus facts, I'll ask you guys to actually put kind of an M or an F in the chat box so we know if most people think it's a myth or it's a fact about depression. So I'll go ahead and share my screen and let's get started. All right, so our topic this evening is understanding mood disorders in children and teens. And I think the pandemic has again really highlighted the importance of mental health, but also I think depression has been uniquely a part or an increased kind of outcome of the pandemic. And we'll kind of talk a little bit through that in the beginning. So I think it's a timely topic for us to be thinking about that in January and at this part in the pandemic. So our agenda for this evening, we'll talk a little bit at the beginning about COVID-19, so the impact of the pandemic on depression and child mental health, to kind of set the stage for some of the information that we're going to learn next. Understand the facts about depression, understand different mood disorders and their symptoms. So depression's one of a set of mood disorders. So we'll talk through what some of those are and what are their symptoms and the differences. learn about effective treatment for depression, and also learn about suicide prevention and ways that you can help. So we'll sprinkle throughout this parent tips and tricks to really help kind of get some of this relevant information from kids to help you feel like you can understand kind of what kids are thinking and feeling, but also support them better as well. The goal for today is again to provide education, so not to promote diagnosis of mental health conditions or prescribe treatment. So if you feel like your child would benefit from treatment, this is something that should be done individually with a mental health professional. So starting with the pandemic and really giving us an overall view, again, everybody has now been in this pandemic for, it's really hard to believe, but almost a year, right? So a couple of months shy of a year at this point, and it's really unbelievable, I think, the impact that it's had on children and teens and parents. So looking at a little bit of the data overall, so 99% of the world's children are living in a restricted environment at this point, meaning restricted from some kind of movement, that we can't kind of move freely about the world as we used to be able to do, before March of last year. 60% of the world's children are on some form of lockdown or partial lockdown so that they're really unable to leave their house. And 1.5 billion children are out of school. So out of that traditional learning environment, which we know can be a social support and academic support and so much more for our kids. Data on the child impact that we have so far from COVID really comes primarily from other countries who were a little bit further along from us in the pandemic at the start of 2020. So one study found that about 22% of kids 7 to 18 reported symptoms of clinical depression. So that's meeting criteria for a diagnosis of major depression. And that was up 10% from prior years. Another study found that middle and high school students reported 43.7 had symptoms of depression, 37.4 were reporting symptoms of anxiety, and 31 had symptoms of both. So depression and anxiety, we will call kind of close cousins of each other sometimes. So some of the symptoms of depression can certainly overlap with anxiety and vice versa. Symptoms are also worse for females is what they found, and worsened as students got older. So as kids got older into the middle schools and then transitioned to high school, some of the impact of depression and anxiety grew. And I think that makes sense based on what we know again about kind of developmental stages. So kids are starting to transition to being more independent, more social, doing more activities outside the home and really excited about that. And I think the virus has really impacted their ability to do the things that they would be excited about and typically do. If we think about the pandemic overall, there are a lot of key factors that I think are really contributing to worsened mental health. And as we're thinking about this today, particularly related to mood disorders, I think loneliness is certainly one of those. So the social isolation that people are experiencing can certainly contribute to clinical depression. Uncertainty, so uncertainty about the future, when is it going to end, when are things going to go back to normal? Again, as we're almost a year into the pandemic at this point, I think that uncertainty about the future can leave people feeling a little bit hopeless and unsure about the future. The lack of predictability, so things changing pretty often can lead to a lot of hope and then kind of having that hope dashed. And so I think that cycle is particularly hard for kids. Not that it's not hard for adults, but I think kids get really excited pretty quickly and then, can also be kind of pretty bummed pretty quickly as well. And then fear, people are just worried about how long is it going to go on? Are they going to be able to do anything to change it? And so I think my hope this evening is to really be thinking about ways that as parents and as educators, we can instill hope in kids and really help to reassure them about themselves, about the world, and about the future. Those are the three things that we know uniquely are related to one's experience of depression. So the parent takeaway from the beginning part and thinking about it related to COVID is really impacting children and teens significantly. Again, more as they get a little bit older. And they're really feeling a sense of loss from some of that independence and some of that social connectedness that, again, many of our teens and young adults look forward to. The extent of which COVID is impacting children and teens, we don't know just yet. So there's not a lot of data that's come out so far that's really been able to document the impact. Though we don't have data to, support that necessarily at this point from the United States, I think we certainly all know from our own experience that this is having a great impact on children and teens and parents as well. I think parents are in a really uniquely stressful position as they're helping kids manage these transition and changes. You know, they're experiencing changes themselves, and everybody's trying to figure out how can we be, you know, hopeful about the future and, you know, take it day to day. So I think that kids and parents are really in a similar boat sometimes. So really check in with children and see how they're feeling. So checking in with kids periodically is a great idea, because the more that time goes on, and again, the more that they might experience stressors or changes from remote learning back to in-person learning, it's really important to check in frequently and see how are they feeling. How do they feel about the current kind of state of the state, so to speak, and how are they coping with COVID? So what are they doing to try and manage some of these feelings? Are they managing it in ways that they have found pretty helpful? And if so, it's awesome to kind of hear about that and, you know, praise them and help them really be reinforced for doing a great job. It's also an opportunity, if they're really struggling, to open up that line of communication and to see if there are ways that they might be able to cope a little bit more effectively, or that you could help with that. When talking with children about tough topics and when thinking about that related to mood, you really want to listen attentively and limit the number of questions that you ask. So you really want to understand from your child's perspective, what's their experience? And so phrases like, tell me more about it, explain what you mean, and how can I help, can be really effective at encouraging a conversation and helping you to really get a sense of where kids are and how you might be able to help them. All right, so here's the part that I would love for you guys to be able to chime in and let us know if you think this is a myth or a fact. So these are all myths or facts about depression. So here's the first one. One primary symptom of depression in children and teens is irritability. All right, myth or fact? What do you guys think? Well, it looks like we have some chiming in there. Oh, sorry, I couldn't see them all. All right, fact, fact, fact. Not sure. Nice job. Thank you guys. I appreciate all the participation. It's awesome without being able to see you guys and do this in front of a live audience. I really appreciate you guys taking a risk and telling me whether they're myths or facts. So thank you so much. So one primary symptom of depression in children and teens is irritability. This is a fact. So irritability is one of the primary symptom differences between adults and children and teens. I think this is really important, and I usually present this piece of information up front in most of the talks that I'll do about depression, because I think what you'll see from kids is not necessarily a classic presentation of sadness, kind of being lethargic, staying in their beds a lot of the time. I think more people are actually reporting that in COVID than I would say was my clinical, you know, practice experience before COVID, just because nobody's leaving the house as much. But irritability and argumentativeness and being really edgy and having just a lot of difficulty with kind of day-to-day kind of conversations and a lot of snappiness is what parents will report from kids about irritability. And kids report that about themselves. So oftentimes people will come in feeling like they're really angry, but it might actually be an underlying depression. The reason for this, I think, kind of makes a lot of sense when we break it down. So as adults, you can control what you do. So as an adult, if you were experiencing depression, you can control like when you get up, when you might eat breakfast, when you would go to work, right? What activities you would do, those types of things. But as a child, you have to still keep doing a lot of these things because parents are you can't not go to school. You know, again, obviously we have remote learning now, but you're going to have to engage in school in some form or fashion. You're going to have to come downstairs. You're going to have to get dressed. And so parents are putting a lot of demands on kids when they're really not necessarily feeling like they're able to meet those quite as much. And so it's why we see irritability as one of the dominant symptoms. So in most intakes that I do for depression, I think this is, again, a dominant part of the experience for children and parents. All right, so let's look at the next one. If someone wants to kill him or herself, nothing can be done. So if this is how somebody feels, there's nothing that can be done to change that. Is that a myth or a fact? Nice work. I'm seeing a lot of myths in there. Yes, you guys are correct. So this is definitely a myth. We know that one person asking how somebody's feeling and if this is the way that they're kind of thinking or if they've had those thoughts before, we know that one person asking that question can help make an important difference and can save a life. It's repeated time and time and time again in the research. So one person that asks this question and asks people, right, how they're feeling, there are many opportunities to be helpful. Awesome job. All right, here's the next one. Myth versus fact. Teens will reach out to peers or a trusted adult and share signs of depression and thoughts of suicide if parents and peers show that they're willing to listen. Myth or a fact? Are kids open about this, or do they kind of keep closed off and quiet? I'm seeing a mix here. I'm seeing a mix. Thank you, guys. So this is a fact. So it isn't necessarily easy to talk about depression, but we know that youth will talk about it if we invite the conversation. So though it might be a difficult conversation to start, we know that if we invite the conversation, if we're open to it, if we're supportive and we let kids know that we're there to help them, that they will definitely share thoughts about depression and suicidal thoughts if they know that people are ready to and willing to listen. All right, here's the next one. You must have a reason to be depressed. There has to be a cause that we can identify, something that we can point to that says, yes, this is why you're depressed. Myth or a fact? All right, I'm seeing a lot of myths coming in. Thank you guys for continuing to participate. You're right. So depression can happen to anyone. And it can be the result of biology, so it could be a chemical imbalance, or it could be partially genetic, stress, or other environmental factors. So there's not necessarily oftentimes one very specific reason that we can say, like, this is where you started to be depressed and we started to see the symptom change. Oftentimes it's a little bit more gradual and over time, particularly with kids. All right, here's the next one. Asking somebody whether they're having thoughts of killing themselves gives them the idea. So if you ask somebody, are you having thoughts about killing yourself? That gives them the idea, puts the idea in their head. So I'm seeing a lot of myths come in. You guys are doing an awesome job, right? You're already experts at this. So this is one of the #1 myths in research about depression, public education, and suicide prevention. There's no research that supports that this is true. And so it's the myth that prevents people from asking these questions the most. And so every time that I give a presentation about depression, mood, or stress, I always really like to highlight this fact because I think it helps everyone to feel a little bit more empowered to be able to ask the question and a little bit more relaxed about engaging in these conversations. Again, they're not necessarily easy conversations or questions to ask, but there's no real magical question. It's that you want to know if this is something, you know, if you're having thoughts of killing yourself or if that's something that you ever thought about. Just asking a question like that very directly and simply, we know that kids will be willing to answer. So if you're asking the question, they know that you're willing to be able to listen and hear the answer, and they can, again, get supported. And we know that asking that question can also be a lifesaver. So thank you guys. You did an awesome job. I really appreciate it. All of the participation in the chat was great. So again, as we're going through this, please use the chat to reach out to us with other questions. So here's some facts about depression, and this is kind of prior to COVID. So this is in the general population related to children. What do we know? So at any given time, 3.2% of children aged 3 to 17 have diagnosed depression, so clinical depression. Rates of having been diagnosed with depression in children in this age range didn't change that much the last time that we surveyed that. Again, my guess would be that if we are now doing research related to COVID, I think we're going to see something different there, but we don't have that data just yet. 2 out of 3 children with depression do not receive treatment for the depression. And that's a fact that I think is really important for us to understand, because children are oftentimes suffering with some of these symptoms and not necessarily having the right support or right treatment to help them feel a little bit better. Approximately 1 in 15 high school students reports attempting suicide each year. It's estimated that for every death by suicide, there are 100 to 200 attempts that are made. And again, it's more difficult to document attempts. Suicide is the second leading cause of death in children aged 10 to 19. Are some of these facts surprising to you guys? You can use the chat to kind of share if some of these were surprising, and if so, kind of which fact might have been the most surprising to you. I think these are really kind of sobering statistics for us to think about. So any fact that stands out to anybody or a surprise that was in there? Yeah, 1 in 15 is a really high number. Yes, it's much higher than I think we realize. And that it's the second leading cause of death in this age range, I think is just really striking when you hear that information and you think about that. It's just really hard, right, to kind of think about this topic as it relates to children and thinking about how much hope kind of might be there in their lives. And so again, it's what makes me really passionate about my job, is being able to help kids find that hope so that this is not a solution that they see as viable. I also saw another really good comment that all of these numbers might go up with COVID. And I think that's something that we're all concerned about. I think the demand for mental health treatment is higher than ever. I also think it gives us a real opportunity to start talking about this. So I think we're, as a society, more comfortable talking about ADHD and anxiety as it relates to kids than we're really comfortable talking about depression. And again, that could be for I uniquely kind of work with obviously children and adolescents, but I think that's related to adults and children, that we're not as comfortable talking about this, but the consequences of not doing that can be really drastic. So thank you guys again for chiming in about that. I think the statistics about suicide are really challenging to hear and think about. So we're going to talk through a little bit of all the different mood disorders. So these are kind of the most common disorders that if you think about mood disorder, and I'm covering a topic related to mood, these are the things that are the most common, either that in clinical practice that we see or that people ask questions about. So this is kind of how I came up with a short list. Major depressive disorder is how you would think about, that's your classic depression presentation. So most people, when they're talking about depression, think about what's called major depressive disorder. Major depressive disorder is characterized by having a lot of the symptoms that we're going to talk about in these next two slides. So the majority of those symptoms that are impacting your day-to-day life and routine, preventing you from, doing your activities of daily living for at least 2 weeks, the majority of the time. And major depression can be categorized in mild, moderate, and severe. Going from kind of mild to moderate to severe, there are increases in the amount of impact that it's having. And so that's how we're kind of thinking about that and assessing, is this a mild, moderate, or severe? I'm thinking about impairment. So how much is this impairing day-to-day life? And what's the significance of that impact? Obviously, suicidal thinking could be related to any of those, right? Mild, moderate, or severe, but also may worsen the more severe the depression is. Persistent depressive disorder. This is something that I'll personally be really interested as a psychologist to learn a little bit more about as we kind of see some of the research coming out of COVID. It's also not a diagnosis that I think you hear a lot, but certainly happens in children and adults. And so it used to be called dysthymia. So if people are familiar with the diagnosis dysthymia in our prior diagnostic manual, it's now called persistent depressive disorder. So what persistent depressive disorder is really thinking about a low-grade depression that's been going on. So having some of the symptoms that we'll talk about in a minute, but not all of them, and having those for a year or more. So having that low-lying mood for more than a year. And one of my favorite authors about mood disorders is Mary Freystedt from The Ohio State University. And when I've had a chance to work with Mary, one of her analogies about persistent depressive disorder has always been my favorite. And so she used to really think about this as having a fever. So thinking about it in kind of terms of a medical condition. So if you had a fever about 99, 99 and a half, so a little bit less than 100 all year, that's probably how you'd feel if you had persistent depressive disorder. You wouldn't have as much energy. You'd be a little bit edgy and irritable. You wouldn't quite feel like yourself, but you wouldn't necessarily be missing school, right? So a temperature less than 100 doesn't keep you out of school or keep you home, but you really wouldn't feel quite right. and it wouldn't be something that improved necessarily over time. And so I think that's one that I'll be really interested to know whether that increases and that experience changes as a result of COVID, as we're kind of nearing a year of having some of these changes to our day-to-day life. I put up adjustment disorder with depressed mood as well, because I think this is something that uniquely related to the pandemic that I'm certainly seeing more and more. So adjustment disorders are a broader category. So you can have adjustment to some kind of transition or change in your life. So there has to be some kind of identified stressor that happened, and then you started to experience the symptoms. And so adjusting to COVID, I think, has created a lot of adjustment with kind of this low mood, because we might say that without COVID, you wouldn't have necessarily had some of those symptoms. And so really looking at that timeline for adjustment disorder of what happened before, right, kind of the pandemic, and what happened after has been really important, because the longer that it goes on, it's kind of tough for us to think about, you know, what was kind of mood or day-to-day activity like before we encountered COVID. And so this adjustment disorder with depressed mood has certainly been something that, again, thinking about that in the pandemic, has happened more. But you can have adjustment disorder with anxiety, you can have it with kind of disruptive behavior or depressed mood, and a combination of those. Unspecified depression. So unspecified depression, I think, sometimes gets a bad rap, right, so to speak, because it sounds like we just don't know what kind of depression it is. And so sometimes you will see a high degree of irritability and a lot of negative thinking, like those two symptoms, just for instance, that don't necessarily result in a lot of changes to day-to-day life. You're still going to school, you're still doing those things, but that negative worldview and that negative kind of thinking cycle and a little bit of that lethargy really does impact you day to day. And so this is something that you see a little bit more with kids that might not meet the criteria of one of these other disorders. So I put bipolar disorder last because it's in a really different class of mood disorders. So I think that people ask a lot of questions when I do presentations about mood disorders about bipolar. And I feel like one of the common questions is, how do we really think about bipolar disorder? And is it just a shift in mood? And so bipolar disorder is not characterized by just a shift from kind of being happy one minute to being really sad to another minute. Actually, kids are really adaptive. And so kids will oftentimes be really, really upset about something and then kind of get distracted and quickly move on and forget about it. And that's not something that would be characteristic of bipolar disorder in and of itself. So oftentimes that's a really adaptive response that kids can move on from things a little bit more quickly. So bipolar disorder is really characterized by having symptoms of major depression at certain times and meeting that criteria, and having that rotate with what we would call elevated mood. So having a significantly elevated mood, and that's really having a lot more kind of hyperactivity, racing thoughts, intense thoughts about your ability, right? Kind of grandiose thinking that you're better than everybody else at certain things that really happens for a certain period of time. So it's much more than a typical happy mood. And so sometimes you'll also see, right, so some improvement from depression where it may feel like that's kind of elevated mood, but it might just be kind of a return to, you know, what the child's baseline is. Bipolar disorder is exceedingly rare in a pediatric population, so it's not one of the most common diagnoses that we would see in children and adolescents. Any thoughts or questions about these as we start to dive into the symptoms a little bit more? Okay. So let's think about, what does this look like? So really focusing on kind of the major depression, persistent depressive disorder, and this adjustment disorder with depressed mood. All of them can have pieces and parts of these symptoms. It's not required to have all of them to meet the criteria for clinical depression. So affect can be really flat. Flat affect really looks like not a very wide range of emotions. So everything could be like kind of meh. To use the word that kids use a lot these days, it's kind of like meh, like everything is kind of okay, or like not that good. And you don't see a lot of variation in that day to day, so that certain activities don't necessarily elevate that, and they don't necessarily decrease it either. You're just not seeing a lot of change in response to day-to-day situations. They feel hopeless, so that you feel like there's no hope that you have either for yourself, for the future, for the world. Those three areas are really characteristic of kind of thinking related to depression. So am I feeling kind of negative or hopeless about myself? Am I feeling hopeless or negative about the world? And am I feeling hopeless and negative about kind of other people? Tearfulness, kids actually do have a lot of tearfulness. And so like not necessarily crying where you think of more of that classic kind of adult response where you see a lot more crying. Kids will get really tearful and then they'll kind of stop and control those feelings a little bit more. Oftentimes because it could happen at school, it could happen in times where they don't kind of want to be embarrassed by crying. Irritable mood, which we talked about before. So that specific difference between children and adults is this irritable mood. And again, there's not very many kids that I would say don't experience this irritable mood in the context of depression. It's just a really notable feature. Loss of interest in activities. So really not having a lot of interest in doing anything. I think this one for me has been more challenging to evaluate based on COVID because of the lack of activities. And so I'm really having to kind of think about what was it like before COVID and how active would this child have been? How interested might they be in even kind of modifying or doing changes and things? You can't see people in person. Are they interested in doing kind of Zoom meetings with friends or Netflix kind of get-togethers where you can all kind of join together and watch the same movie? How open are they to kind of trying some new activities or being interested in that? Changes in eating habits and weight. So eating more and gaining weight or eating less and losing weight. So any significant change in weight in either direction could be a symptom of depression. Sometimes people eat more and then sometimes people feel like they're really not hungry and forget to eat. Difficulty sleeping. This could be not feeling like you can fall asleep or it can be sleeping too much. And again, certainly more than you would see from the classic transition to adolescence. So adolescents all like to sleep a little bit more, and research says that they actually need to sleep more than younger children, but this would be far in excess of that. Tiredness at school, tiredness in day-to-day activities that they just don't feel well rested. Slowed motor movements, so just seeming really slow to get started, taking a long time to do things, and that other people are kind of noticing this. You'd be able to see it in your day-to-day routine. Kind of having loss of energy or fatigue, so not really feeling like you have a lot of energy to go to kind of day-to-day activities. Negative thoughts about themselves. So we talked a little bit about some of that negative thinking that's associated with depression. So negative thoughts about themselves, and again, feeling kind of badly about something about themselves. That could be self-esteem, that could be about how other people kind of view them, negative thoughts about the world or how other people are perceiving them. Inappropriate levels of guilt. So sometimes you get a lot of apologizing that might happen. You get that with anxiety as well. It's where you see some of the overlap between anxiety and depression, is that kids really feel very guilty that they're not doing some of the things that they might typically do, right? Or kid who would really be keeping up on homework is really struggling to keep up with homework, and they feel a lot of guilt and pressure about that. Diminished ability to concentrate, that's characteristic actually across a number of childhood disorders. And so you just really feel like you can't concentrate, but it's not because of an attention challenge or anxiety. It's that you really just feel like you're so tired is the reason most of the time that kids would report that. They're being kind of tired and just not motivated. Recurrent thoughts of death with suicidal ideation or intent. Is certainly something that comes along with depression more than it's associated with other disorders. And then changes in routine and behavior. So doing things really differently than they would have done, last week or last month, and just kind of making a lot of changes to their day-to-day routines or kind of behavior. So it's important for us to think about what's a typical mood change versus what's something more. So everybody feels sad and cheerful at some times, and this could go away without any intervention. I'm sure that everybody's probably had a time during COVID where they had some of these like thoughts and feelings. Is this going to change? Is it ever going to go away? And had some of that sense of, loss and kind of loneliness as we're going through this pandemic. But depression is really, clinical depression is a pattern of behavior over time. So it needs to be going on more days than not for at least 2 weeks that you're seeing these symptoms, a good number of these symptoms, more days than not for at least 2 weeks in a row. And that the symptoms have to be preventing success in some way. So are they preventing success at school? Are they preventing success with friends? Are they interfering with family activities to where, kids are isolated, not engaging anymore? Their sleeping and eating has changed. And the one thing we really want to make sure that we take seriously is anytime that a child expresses suicidal ideation, this should always be taken seriously. I think sometimes, again, kids might say this or kind of throw this around, and parents question, is this something that's really serious? I think when a child expresses this, we should always approach it with caution and making sure that we address it. So it always warrants kind of immediate attention. So we want to ask the question, is this really a thought that you're having? Are you really having thoughts about wanting to take your own life or wanting to kill yourself? Tell me a little bit more about that. And then if so, you want to make sure to kind of access some of those crisis resources. So we'll go over some of those resources at the end as well. But we don't want to take the risk that this is a joke. So anytime that a child expresses this, I'm going to take it seriously and make sure that we do our due diligence to kind of follow through and make sure that this is not a significant concern that they're having for their life. So parent takeaways here, really pay attention to behavior patterns in children and teens. Sometimes it's hard to kind of notice these day-to-day changes, particularly in COVID, where every day kind of feels a little bit like it's the same. But really kind of notice things that they used to do that, boy, I wonder why, they haven't come down and joined us for dinner lately, or wonder why they've kind of avoided this activity. So really be paying attention for those changes and how long they've been going on. Talk to kids and teens and be open to hearing how they feel. So be ready for these conversations. Asking them, what's your mood like day to day? What helps to improve your mood? What makes your mood a little bit worse? Has it happened more recently? And would it be helpful to talk to somebody about it? I think are good questions that can help to understand, again, how are they thinking and what might you be able to do from a parent to support that, or if they need a little bit more help. Ask questions about suicide directly. So have you ever had any thoughts about killing yourself? Is a really simple way to ask this question. And we know that the directness is going to get the answer that you need in that situation. So treatment, any thoughts or questions after we went through the symptoms? I'll just pause for a second here to see if anybody had any particular questions or anything that kind of struck them from this information before we transition to talking about treatment a little bit. No? Okay. So what do we know about treatment for depression? We know that it's really effective. Mild depression is often treatable with therapy alone. So mild depression could be treated entirely with just a therapeutic intervention. And we'll talk a little bit about what effective therapeutic intervention looks like for depression. Moderate to severe depression often might need a combination of effective treatment and medication to really help because of the significance of the symptoms. Effective therapy is cognitive behavioral therapy. So we know the most about cognitive behavioral therapy for children, and we know that it's effective. Family involvement in cognitive behavioral therapy is crucial. I know sometimes when we think about depression and we think about kind of how kids are experiencing and these negative thoughts about themselves, so we think about it a little bit more individual. And I think family involvement is super important. Again, this is my personal practice in terms of treatment, but I think family involvement is crucial to really help to make some of the changes and sustain those changes over time. So the reality is that I am a cognitive behavioral therapist, but I am not the person who's in a family's home most of the time dealing with and managing the situations that are related to depression. And so I really want parents to feel empowered as a part of treatment, to feel like they have an active role in helping their child to feel better. And we'll talk a little bit about what cognitive behavioral therapy is. So parents and caregivers should be included in treatment for children and teens for depression as much as anything else, right? ADHD or anxiety. It's a missed opportunity, I think, if we're not including parents in sessions about depression. So cognitive behavioral therapy, what do we know about CBT? Cognitive behavioral therapy is this idea, and like how we apply this to kind of depression is thinking about how are our thoughts and feelings and behaviors all connected together, and how do they result in the symptoms that you're seeing? And so from a cognitive behavioral perspective, oftentimes what we can kind of see first and what parents and kids are noticing the most are feelings. So you notice that you're feeling sad, that you're feeling angry, that you're feeling irritable, you're feeling unmotivated, those types of things. We might be able to say that and describe that. Many kids can describe kind of what depression feels like to them. We also see a lot of the behaviors. So because you're feeling sad, because you're feeling irritable, we recognize changes in your behavior. So increased arguments, lack of follow through with homework, avoidance of activities, isolation. So I'm avoiding people because I feel kind of sad when I'm around other people. It kind of causes me to feel upset. So I isolate myself. The part that's really important for us to think about, and this is more important for older kids, so kids kind of 8 and older, I'll draw the line at 8 and thinking about that. So younger children with depression don't necessarily have a lot of intense and complex thoughts about their depression. So oftentimes they feel sad, they might have an action, and it's because they feel bad about themselves. And that might be the complexity of that thought, because younger kids can't really think about their own thinking. What we know about older kids and depression treatment in older children, teens, and adults is that oftentimes what happens are we have automatic negative thoughts in different situations. And these automatic thoughts that are happening and occurring are what's predicting how we're feeling and what we're doing. But again, these thoughts are occurring automatically. So many kids, teens, and parents don't necessarily know that that's kind of what happens. And so that's kind of an important part of therapy, is to really think about and understand, after we can identify what the feelings are and we think about some of these behaviors, that we really also work to kind of isolate, are there some thoughts that are driving this, and ways that we can kind of challenge some of those thoughts. So a good example would be, let's say that a child avoids a social activity. So a child is feeling a little bit sad, a little bit unmotivated, and what they do is avoid a social activity. The thought that might be driving that would be, nobody really likes me when I go and hang out with them anyway. But that thought, that nobody likes me, isn't necessarily the first thing that kids are going to say in that situation. They're going to say that they feel bad, so they didn't want to go. But this thought part, again, can be really important because it predicts what you're doing and how you're feeling in that situation. So first we work to identify feelings. We also really work to change behaviors. And so for depression particularly, a lot of what we would call behavior activation is really important. We have to get you engaged in doing things little by little to start to shift your experience. So we know that the more that you're engaged in doing things, as we talked in the beginning about kind of loneliness and isolation, that those really drive depression. So the more that we can get you to engage and be less isolated and more engaged and do more things that we think you're probably going to like if you give a try, and we really work on that, we know that you're going to feel a little bit better. And it gives us a chance to then start kind of identifying what are some of these thoughts and having more of those positive experiences. So we know that cognitive behavioral therapy works. All right, any questions before we transition to a little bit more information about suicide prevention at the end? Any specific questions about depression, depression treatment? Anything that we've talked about so far? No? All right, so it looks like no questions. If you have them and you're wanting to hold them for the end, again, you're welcome to do that too. But if there's a specific question that you're really hoping that we get to, please feel free to ask that so that we can make this as relevant as possible for all of you. So we're going to switch gears a little bit and think specifically about suicide prevention. So we all know that every single one of us can play an important role in preventing suicide. And knowing the warning signs to watch for in children and teens are an important part of preventing suicide. So we separate these oftentimes when we kind of think about them related to talk. So what are things that kids are saying? And then what are things that kids are doing that might kind of give you a clue or a hint or an idea that these are kind of warning signs that suicide could be something that they have thought about. So talk. So kids might talk about wanting to die or talk about suicide, talk about feeling hopeless and not having a reason to live, talk about feeling trapped or in a lot of pain, that they're in a lot of pain and stress and don't know how long that they're going to continue to go on. Talk about being a burden to others. The more that we're learning about suicide prevention and deaths by suicide over time, is that this idea of being burdensome can be really stressful and overwhelming for people. So talking about being a burden, you don't want to be burdening or kind of bothering other people because you're not feeling well, because you're having symptoms of depression. And talking about seeking revenge. So another part of this could also be kind of acting out against somebody else, right? That you feel might be kind of leading to some of that sadness. Looks like there might be a question. Okay, I saw that pop up in the chat. Awesome. So there are many different types. So the question, is it okay if I read the question to everybody? Okay, so many different types of CBT is the question. So are there different types of CBT and what's the most used and most important? This is a great question. So I really appreciate you asking this question because there aren't actually different types of CBT necessarily. So a lot of the ways that people kind of think there are different types of CBT are things like relaxation strategies or kind of behavioral strategies where you're exercising, going for a walk, those types of things. I would consider all of those kind of in the B of CBT, if that makes sense, kind of in that behavioral part. So anything in my kind of broad, my broad use of the word CBT and how we're thinking about that from a clinical research perspective is behavior is really anything that you're doing that could change the way that you're feeling and help you cope with something. So some people find actually mindfulness, relaxation strategies, taking a walk, doing exercise, connecting with a friend, all of those are things that you could do that are kind of behaviors that would help you change your mood somehow. So I think we oftentimes kind of get a little bit challenged to think about what type of CBT is going to be the most effective, but I think all of those things can be considered CBT. The really crucial part about cognitive behavioral therapy is that you need to be doing kind of three things. So there are three required modules, so to speak, about CBT. There are 5 total, but there are 3 actually required. So one of them is education. So we have to have education about the diagnosis, what's the pattern, how do we understand that to be impacting your child, the psychoeducation, so that everybody's on the same page is a required part of any intervention to call it cognitive behavioral therapy. Again, from a research perspective and clinical perspective. The second required part is this part that's called self-monitoring. So really doing some kind of tracking, sequencing, talking through situations and behaviors, and really helping you to kind of identify, or parents to identify, what are the thoughts, feelings, and behaviors that are going on that are kind of causing the symptom. So we have to do some type of self-monitoring activity to kind of increase that awareness. So how do you know that you're having this feeling? What are you doing? And then kind of what are you thinking? That's a really required part of CBT. We have to kind of help to develop some insight into why we're thinking and feeling and doing the things that we're doing. The last required part is something called exposure. So you have to actually do something different to take an active step to change something. And that's a required part of CBT too. So that if you talk about, you know, what you're going to do and how you're going to use a strategy and change it, but you don't actually ever implement it, then it's not going to be a very successful cognitive behavioral intervention. So we know that you have to do something different. The interesting part, I guess, to me as a provider, but to think about as a parent, is the cognitive part. So this thought part is kind of optional. So some kids don't really have a cognitive part of depression. Again, younger kids don't have very complex thoughts about this. And the behavior part is the other part that's optional. So you could have a very cognitive part of depression, and it might not be changing a lot of what you're doing. So you could be a great student engaged in a lot of activities and have a lot of negative thoughts about yourself. So how much you're using cognitive strategies or behavior strategies is really dependent on the individual and the family and the child and kind of what symptoms that they're experiencing. So great CBT should make sure that you're doing those 3 things. So lots of education, a lot of self-monitoring, and kind of increasing the awareness of the process and connecting those together, and then doing something different. So you have to do something from an exposure perspective to try something different. How much you do the C and the B are based on your unique presentation. I think sometimes people think about also DBT. So I've heard people talk about DBT a lot and wonder if that's the same or that's different than cognitive behavioral therapy. It's also a close cousin. A lot of the strategies are very similar, but it's aimed at a very specific population. So I think that's a really, really great question. And as a parent, I think you want to just be thinking about, is this kind of what we're getting, right? Do we understand what this is? Are we developing some awareness, and are we working to kind of change something? Those are the 3 things that I would really keep in mind when you're kind of evaluating therapy, and then whether kind of an intervention is cognitive behavioral therapy. So is that helpful? I know it's a little bit of a long answer, but I also feel pretty passionate about good education about CBT. So thanks for asking that. DBT, so dialectical behavior therapy. Is the other part. So dialectical behavior therapy does a lot of actually behavioral work and then helps you to kind of increase this awareness and self-monitoring, but it's aimed at suicidal behaviors very specifically. So that's one of the most common questions that I get when I do depression workshops as well. Great question. Any other questions? Thank you for asking it. Okay. All right, so let's talk a little bit about the behavior. So what are warning signs in terms of behavior that might indicate that a child or somebody that you know is thinking about suicide? Looking for ways to kill yourself, so online. So what do search histories look like? Search histories on computers, search histories on phones. What are kids kind of thinking about? What are they doing? What's the content that they're looking at? And does this then somehow relate to wanting to end their life? Obviously, children can't purchase weapons, but trying to find a weapon or get access to a weapon. We know that means restriction, so restricting the likelihood that you have a weapon in the home or that you have a weapon in the home is a #1 strategy that will help reduce deaths by suicide. So having access to a weapon increases the risk of suicide completion. Visiting or calling people to say goodbye. So talking to people, saying things like, hey, right, I might not see you for a while, those types of things. You really want to pay attention to that. Giving away possessions, so things that your child really likes and that they don't really care about anymore, giving away their favorite sweatshirt to a friend or a relative. Increasing or starting alcohol or drug use as a ineffective coping strategy. Behaving recklessly, so doing things that they would never necessarily do normally because they really don't care about the consequences, right? So that could be driving recklessly, that could be, taking a lot of dangerous risks, like with friends, those types of things. That's kind of uncharacteristic. Sleeping changes, so sleeping a ton, really feeling like they're sleeping a lot and that they're not necessarily kind of wanting to wake up. Withdrawal, extreme isolation. So not wanting to do really anything, not coming out of the room, and that this behavior kind of continues to go on and isn't necessarily very amenable to change. So they're not very open to coming downstairs, to engaging in an activity, that they're just remaining really isolated. An extreme mood swing. So seeing a lot of like a very small trigger lead to a very large upset, kind of angry, sad, tearful outbursts that would be really uncharacteristic. So again, those are some of the things that kids could be saying and the things that they might be doing that could indicate to us that they could be considering ending their life. Protective factors. So I think it's really important for us to think about what do we know in terms of suicide risk assessment and what are ways that we kind of reduce risk of death by suicide. And there are these things called protective factors. So the more of these factors that kids have and that families can help kids to develop, it reduces the likelihood that you would have a death by suicide. So having an effective behavioral health care relationship or established therapeutic relationship can be really helpful. So it helps kids to, again, have that support and feel like they can have hope that things are going to be changing, that they're getting the support from parents, from their provider. And that's helping them to feel a little bit better about the future and, how they're feeling about themselves. Connectedness. So connectedness to individuals, families, communities, pets. Pets are really, really important. So they can help kids to feel really connected to their experience. And again, that the pet relies on them for different things and would be sad if they were gone. So this idea of connectedness can be a real insulating factor. Problem-solving skills. So how effectively can kids kind of solve problems? Can they think of 2 or 3 different ways that they would solve a problem? That can be a really effective coping strategy. Coping skills. So what can they do to kind of manage their emotion in the moment? So can they take a walk? Can they, kind of take a shower to kind of relax a little bit? Can they reach out to a friend and seek some support? So what are they doing to kind of cope with distress or when they're feeling kind of upset about something? Being adaptable can be really helpful as well. So kids that are pretty flexible can think about things, again, in a lot of different ways. They might try multiple coping strategies, and all of those things can really help with this idea of adaptability so that they can see a different way to kind of think about the situation that they're in. Self-esteem. So having a self-esteem that's not necessarily very impacted by depression can be really helpful. So it's seeing things that they're good at, things that they used to be good at, that they feel like they can do again. And then cultural, religious, or spiritual beliefs that discourage suicide can also be a protective factor. So if there are communities that kids are living in and messaging that they're getting, that there's hope and that this isn't necessarily a solution that they want to think about, that can be really a protective factor as well. So there's a lot that we can do about it. Looks like there's a question that came in. Is that right? Maybe.
Okay. So the question is, if
Actually, Dr. Kami, do you see the question?
I do. I can actually see it.
Okay. I know I'm getting better at this, right? Over time, I can kind of like see all these things and move them around now. So I appreciate that. So if you feel your child's depressed, especially during the pandemic, so besides seeking therapy intervention and asking kind of how they're feeling, what can we do as parents to help? And I think this is an awesome question. So we can all be a part of the solution. I also think really helping kids, again, the pandemic has created so many challenges for kids and put them in situations that, you know, we're asking them to do things that are adaptable a lot, right? To change to a lot of different situations. And those are not skills that kids all have all the time. So I think one of the most important things that you can do is really establish an open line of communication and make time to connect with kids each day. So really to connect with them in a meaningful way for 5 to 10 minutes a day. So I'm not thinking about this as super long periods of time or kind of going on a car trip where you chit chat about, you know, the meaning of life and those types of things. I'm thinking about brief, really meaningful interactions every day. So checking in with them to say, hey, how was the day today? You know, how'd you feel like it went? What's something that you felt like was good about the day? What didn't go so well? You know, what do you see kind of coming up, or how can I help? You know, what are the things that you struggle with the most? And the more that you make time for those day-to-day conversations, you're going to see that kids are going to open their line of communication overall. And so when there is a challenge, they're going to be a lot more likely to come to you. And knowing that you check in with them each day and have those like brief conversations gives you an opportunity to kind of catch this essentially before it gets too significant. Some kids are also not necessarily, you know, likely to kind of seek support in these times. And so it sometimes does feel like a little bit of work as a parent to make sure that, hey, we're going to set this kind of daily chat time together because I want to make sure that I'm connected to, you know, how you're feeling, what we can do to help you. And, you know, that this is a really challenging time for everybody. So we just want to make sure that you're well supported. I also think, again, communication is probably the number one thing that I would say is something that you could make a regular part of your day-to-day routine in a meaningful way that's going to help a lot. During that communication, I think you can also validate the experience. So as parents, sometimes we really want to have the answer. The pandemic has taught us that there are sometimes not a lot of answers to really, really challenging questions, right? The current things that are kind of going on in the news, those types of things, they're not necessarily easy questions or right or wrong answers to a lot of what we're seeing. And so I think you really want to be validating for kids and let them know that you hear them and that you really value that they're sharing this information and that it's hard, that you're committed to, even though you don't have an answer, that you're committed to figure out what can you do day to day to help them be a little bit more motivated, a little bit more engaged. So what's a strategy that we can come up with that's going to help you to feel like you have a little bit more energy to get that homework done? And as a parent, then you're going to follow through with what that is, right? So if it's like, if we could just spend maybe 30 minutes a day, like sitting together because I have to do this assignment and I just feel like I can't do it on my own. Great. Then let's sit together and let's get that assignment done, right? You tell me when and I will be there, right? You can do work at the same time, but that you're really then starting to kind of figure out what are ways that you can validate and help them to find solutions to some of these challenges. You appreciate their experience, but you want to help. So let's figure out a way that we can find a solution together. So I think those things are really important. Just generally being mindful about exercise and the amount of kind of physical activity that you're getting. And that's not necessarily always exercise, but what you're doing to kind of interact with other people. So that idea of connectedness and kind of limiting isolation. So sometimes parents can set limits on, you know, how much time kids are spending in their room. So for this certain amount of time every night, we really want everybody to kind of be downstairs and like in the mix, so to speak. That's kind of what I call it. We want it to be, you want everybody to be in the mix, right? So that we have a chance to check in, see how you're doing. And we really need to set some limits on how much time that you're spending in your room. And that can be a really effective strategy to, again, kind of open this line of communication, but also help to limit the amount of isolation, you know, increase the amount of connectedness that kids are experiencing. So sometimes it's those little things that you can kind of do day to day that really help kids to feel supported, and then give you the opportunity to kind of stay on top of some of the worries and symptoms that might be related to depression, but kind of prevent it from worsening. Was that a helpful answer to the question? Are there more questions? Looks like maybe. But I oftentimes think of, again, some of these strategies to prevent depression as really great kind of positive interaction strategies, that if you lay the foundation for some of these things day to day, It's going to, one, kind of establish more of that connection and make it more likely kids are going to come to you. But by doing those things, it can sometimes limit the likelihood that you would have a clinical depression or a worsening of a depression. So it looks like a couple more questions maybe in the chat. Okay. Nope, maybe not. All right, anything else? So I want to make sure that everybody has this number. So accessing help. So as we're thinking about suicide prevention, there are some amazing resources that are free and available 24 hours a day, 7 days a week that can really help you as parents and can help children as well, right? So parents can reach out to these resources and say, hey, I'm worried about something that my kid has said, you know, can you please help me talk to them, or can you have a conversation? They are amazingly staffed by mostly volunteers who are really committed to making sure that they're available to help prevent the risk of death by suicide. So reaching out to them at any point of the day or night. If you text or call, you're going to get an immediate response no matter when that is that you call. I actually used to volunteer for one of these hotlines when I was in college, and it was an amazing experience to see the amount of dedication that all of the individuals who staff these lifelines have, because they were really committed to dedicating their time to just be that voice on the end of the line, and then had a lot of training and strategies that they were able to use to be helpful in that moment and also prevent the risk of death by suicide. So making sure that you have these resources, I think, can be really helpful. So equip them for yourselves, equip them for kids. So parent takeaways overall. So kids will definitely talk about their feelings and share things with you if they're really given an opportunity. So sometimes creating that opportunity on a day-to-day basis can be a really impactful strategy to use. So if kids have that opportunity and know that parents are willing to listen, they will be very open to sharing their feelings and thoughts. Pay attention for changes in mood and behavior. So if you notice something that's different, sometimes I call it a little bit of like my spidey sense, to use a superhero metaphor. Sometimes I think to myself, like, my sense about this situation or my sense as a parent or as a provider is that something's a little off. And so if I have that sense and that feeling or that instinct, then you want to ask the question and pay attention. We know that treatment is really effective and that parents are an important part of the process. So parents are crucial to helping shift kids' experience of depression. Asking directly about suicide, we know that it's really important and is life-saving. So one concerned and caring person can definitely save a life. All right, so now I'll open it up for just overall questions. So if there are any questions that kind of occurred throughout the course of the talk, or something that you've kind of heard in the news or had a question about, you're welcome to go ahead and ask it. You guys have done an awesome job of participating all along, so I really, really appreciate that. You guys jumped in and participated all along, which makes it really awesome as a presenter, so I appreciate that. Anything else as we're wrapping up? Comments, questions, ending thoughts? I also think that attending a workshop like tonight is also an important part of making a difference as well. So having all of this education better equips you to think about this in your day-to-day lives for adults, for kids, and for children. So I really appreciate that.
Dr. Kami, I see one other question.
Okay, thank you. Awesome.
Is it true children and teen suicides are up during this pandemic?
Yeah, so I think I am not aware of any very specific data that looks at that in the United States for kids and teens during the pandemic. So sometimes it's just very difficult to get that research. Most of that research is self-report. And so it's hard to kind of get that research as we're we're in an ongoing change situation, if that makes sense. The pandemic is kind of ongoing and changing a lot. And the CDC does regular studies of this behavior. So most of the statistics that I actually went over today are from the CDC. They regularly survey kids, parents, and really look at topics of mental health. And so I think that this is a question that many people suspect is going to be higher or worse into the pandemic. And we know that, again, rates of depression and seeking service and that for adults is up. I'm not aware of any data that specifically documents that increased risk for, children and teens at this point, but we know that some of that exists for adults. So in an earlier talk, I actually presented some data from the CDC in June that would say that adults' experience of depression and thoughts of suicide had significantly increased in the pandemic. So I think it's safe for us to think that that could be the case for our kids as well. Yeah, thank you for asking that question.
Dr. Kami, I don't see any other questions, but I just want to thank you so much. This has been so helpful and informative.
Absolutely, my pleasure.
And we look forward to seeing you next time for your talk on ADHD. So thank you.
That sounds awesome. I look forward to it as well. Again, thank you guys again for interacting. I know it's sometimes hard in the evening and in a virtual presentation. So thank you so much to everybody who attended and really engaged tonight. So thank you so much. And I know that it will be helpful, right, information for you and your family. So thanks so much. And thanks again to Pilot for hosting.
Thank you. We'll see you next month.
All right. Sounds good. Take care, everybody. Stay safe.
Thank you.
Thank you.